Okay, so namaste and good evening to Dr. Anupama SR, resource person of this evening, Mrs. Nisha and Mrs. Jyoti from NIMHANS, who are providing the online and offline support for conducting this webinar. See, as you know, Dr. P.T. Shivakumar is the head of the Geriatric Psychiatry Department of NIMHANS, and his team of doctors are providing background support for these kinds of webinars. In fact, they are not seen here, but anyway, they are the persons who are actually conducting these webinars. I have great pleasure in welcoming you to yet another edition of this webinar. I am happy in welcoming and introducing to you Dr. Anupama SR, resource person of this evening. Dr. Anupama is young, highly educated and experienced doctor. After finishing her MBBS degree from Kaimani Institute of Medical Sciences, Narkatpalli, Nalgonda in Telangana in the year 2015, she joined for MD in Psychiatry at Medicity Institute of Medical Sciences, Vitual, Secunderabad, which is also in Telangana, and completed it in 2022. Her special training in MD is in psychodynamic psychotherapy. People may not know what it is. So psychodynamic therapy focuses on unconscious processes as they are manifested in the client's present behavior. The goals of psychodynamic therapy are client self-awareness and understanding of the influence of the past on present behavior. As regards her experience as a specialist, she has worked as a senior resident in Government Medical College, Nalgonda till June 2023. In July 2023, she has joined NIMHANS, and she is presently a senior resident in NIMHANS and pursuing her Doctor of Medicine, commonly known as DM, which is again a super specialty course. Only top-ranked and highly skilled MD qualified doctors will get admission for it, that too in NIMHANS, considered as the top-class super specialty hospital in this field. I understand that the important reason for her to choose this field of super specialization is her desire to serve the elderly population based on her personal experience of suffering with elderly patients as well as caregivers in her family. I appreciate her for the bold decision taken to specialize and serve these seniors who, according to me, is not a favorite section of the society for the medical field. As a time management tool, I request participants to ask questions, if any, in the chat box for her to answer. You may also raise your doubts after the resource person finishes her presentation. Yes, Dr. Anupama, we thank you for your desire to share your knowledge and experience with us today by spending your valuable time. The floor is now open to you. Please go ahead with your presentation. Thank you, Dr.
Thank you so much, sir, for the very nice introduction. I will be talking about loneliness, how to overcome loneliness. I will try to, I'm sharing my screen, just, yeah. Is it visible?
Yeah, yes, doctor. It is visible.
Yeah. So without much delay, I would start my presentation. So I would be trying to touch upon things that we commonly encounter in elderly population. Loneliness is something that we commonly encounter even in our clinical practice, even in the outpatient department.
Can you just be a little more loud, doctor?
Yes, sir. Yes, sir.
That will be nice. Now this is fantastic.
Okay. So, yes. So, loneliness, why is it important? So, loneliness is something, is a sense of feeling, that I am alone, that sense of feeling uneasy or feeling discomfort, that, I am alone, I have nobody to take care of me, or I have nobody to share things. They have, all of us as human beings have certain expectations with our life, with our social life mainly, that you want somebody to look after you, somebody to share your happiness, your sadness, and you like to socialize with them, go around, do different kinds of activities. So that when there is a mismatch between that expectation and the reality, that there is nobody to fulfill those expectations, is when you start feeling alone, you start feeling very lonely. That is what is loneliness. I'm not going into the technical definition, but overall, that is what the feeling of loneliness is like. Like, you can see this woman is sitting here, probably looking for somebody to come for her cover, to probably for somebody to talk to her or discuss things with her. Then comes social isolation. So social isolation is something that is different from loneliness. It's similar but different, where you are not having much contact with other people in the society, because we human beings are a part of a society. And it's social, when you are not having any kind of contact with other people, like it had happened during the pandemic, where you were not allowed to socialize with people, you were not allowed to have contact with people except probably in a remote fashion. The entire the dynamics of the society had changed at that point of time. So that time people were supposed to, like, and people who were infected were supposed to be staying away. They were not allowed to meet others, and others were not allowed to meet them. So this is one thing. And one more thing is, some people may be living among uh, a group, but still they may feel isolated. They may feel that they do not belong there. Might be because of their differences of, because of differences of opinion, because they are probably not of their age group, or probably their what they expect from these colleagues, or these the others in the group might not be met. The expectations might not be met. So they may also feel isolated. They may also feel lonely. So how does loneliness affect us? So this is important. So loneliness, why it is important is that when you're, can everybody hear me?
Still, there is at least one mention that somebody is saying that no voice or something like that. Sir, Meenakshi
Yes.
Sundram, sir. Sir, Meenakshi Sundram, sir. Sir,
I'm able to listen.
kindly adjust your the volume, sir. See, I think others are able to listen here.
Yes.
Yes, sir. I am able to listen. No problem.
Yeah. See, sir, probably
Okay,
you
I'll
just
just move a little
see, look
forward.
at your settings, sir. Kindly go ahead, please.
So how does loneliness affect us? So when you are alone, there are your biological functions, whatever you do in a day, they might take a hit when you have nobody to take care of you. Your physical health might get affected. There are several articles that I had read about, where they were telling that loneliness might cause heart issues. It might cause it might impact your physical health in a way that you may probably develop lifestyle disorders like diabetes and hypertension. And so when loneliness is more, as it as you start perceiving it a lot more, then that might lead to depression, which is again characterized by sadness of mood, a sense of feeling worthless, a sense of that, that I am not able to that I'm not able to do my work. I feel very weak and very fatigued. So this can happen. And in the long run, when there is no stimulation from outside, when they do not have so when they're feeling they're alone, they do not have any stimulation, there is no dialogue, they are not able to discuss anything with other people. So that might somewhat impact their cognition and might even lead to dementia. So this is another thing where where loneliness is going to affect individuals. Overall, when you compare a person who is who is having social multiple relationships and multiple uh, people to talk to, and there is no sense of loneliness, when you compare them with those who feel lonely, feel that, are what will we do? I am alone. What should I do? There is nobody to look after. There is nobody to give food to. Even if they want to cook for one person, what will I cook? So that kind of a thing, their quality of life slowly decreases, and overall they will be leading a low quality of life. But again, there are special instances where you have conditions like autism, where social skills are low. There is no, where social cognition is impaired, where they cannot relate to other persons. Their loneliness might not be as impactful as it might be in people who are otherwise normally able to socialize. So next, so coming to how social isolation and loneliness affect and what other things they may impact. One is, they say that it can cause heart diseases, high blood pressure, obesity, basically our lifestyle disorders. Immunity might also be weakened. It might cause anxiety, that, you know, that sense of the tense kind of a situation where they feel very anxious. They are afraid of doing things. They are afraid of going out. Probably they are uh, afraid of socializing. They're afraid of buying simple things, simple chores like buying groceries or something. That also might cause them a sense or tension or anxiety that people tell us. So that can be there. They might be very irritable, that, you know, nothing is working in my favor, nothing is as per plan. So that could be there. If they want to go out, they'll be like, oh, I'm getting late. So they'll, that sense of that fear and that anxiety will be there. And depression, like I said, there'll be low mood, there'll be lack of interest. They start feeling worthless and lonely, and their sleep and appetite will also reduce. So that is there, and they probably will not be able to do things that they were comfortably doing before when they are depressed. And then you have cognitive decline. Like I said, there is no stimulation coming from outside. They're not interacting with people. There is no exchange of ideas. There is no exchange of information that might cause cognitive decline. And slowly from depression, then cognitive decline, then it might progress to dementia, which is a relatively more severe condition. Also, loneliness can lead to suicides. They may start feeling so lonely. They may start feeling that, Arey, my life is not worth living at all. And they may also die by suicide. Also, with all the kinds of lifestyle disorders that they may get, they might die earlier than the expected, the life expectancy might come down. Then this is something that we encounter regularly. So there is something called family cycle, where, you know, an individual is there, he's living with his parents, he gets married, then he goes, he's probably separates from his parents, and then he has children. But the children, when their children are young, they live with the parents, and then slowly they grow up, they go to college, they go to work, and they may even have to leave their house. So when, if for example, if you take a couple with two children, so first child leaves, there is some kind of, they start feeling that emptiness. And then when the second child also leaves and only the couple remain at the house, the nest is empty, right? There are no children, the nest is empty. So they start feeling a little distressed. Ki, what will happen in the future? What will happen? Who will take care of me? Who should I wake up for? Who should I start doing things for? So this is known as emptiness syndrome, in very in simpler terms. And when the couple are living and one of them falls ill and they die and only the spouse remains, that is again going to cause a lot of problems. Like, they will start feeling lonely, they start looking for purpose in life, they do not know. I'm not saying it will happen in everybody, but it might happen in people who are more vulnerable. And it is going to increase in the near future, because we are slowly moving away from the traditional joint family system into the nuclear family system, where maybe a couple have two children or one child, or, and I think most people are opting not to have children also. So in such cases, loneliness is going to be a major problem that people will be encountering in the near future. Maybe in a decade or two, we will start seeing even that. And there will be a lot of other issues, like a person is lonely they are more vulnerable to people who can scam them. So like UPV people keep getting messages like, you know, you have won a lottery, or you won some large sum of prize money, etc. And these people who are living alone, and if there is some kind of cognitive decline, they are more vulnerable to these kind of scams, and they might get cheated and they might be robbed of their savings and their money. So that is one more problem. And how to overcome loneliness? So we can so what we can do is, so for ideally, if they are living in a family and if there are people to take care of them, that might reassure them, and that sense of loneliness might not be there if the environment is good. And if the caregivers living with them, the grandchildren, the children living with them are able to manage and able to fulfill the needs, their expectations and versus reality is matching, then that is the most ideal society, ideal thing. But then we all know that there is nothing ideal that we generally see. So maybe we should encourage our elderly population of the society to join community groups in the locality. Like you have mostly when it comes to India, we have temples, we have mosques, we have churches, we have a religion where religion is given more importance. People who are religious may probably go join them. They might mingle with the people of their age group and try to interact with them, participate in group activities. They can do that. That can be one thing. Then we can have, there are a lot of localities where there are yoga and other group activities where people go for these laughter clubs and all that. So such kind of things can be encouraged. And social media, I would say there are a lot of people who are now like in the age group of 50, 60, maybe they were exposed to internet early on, and they're quite, I see that in my experience too, that they're quite active on social media, posting pictures, posting a lot of things, sharing information. So such kind of things can happen. And even VMS is one of them. Like people do join these meetings, and though it is like a webinar, people do come and join. So these kind of social media activities that are also encouraged. But again, with social media, the downside is that you have virtual friends definitely on Facebook and Instagram and other Twitter. So you have uh, friends, virtual friends, but again, how far these virtual friends are going to help you in your real life is the thing. So it applies to all age groups, not just the elderly, where your virtual friendships might be good. Virtual friendships might be keeping you happy and making you feel less lonely. But again, when something happens, some crisis hits, these virtual people will not be available, most likely, if they are from a far off place. If they are near your house or something like that, then maybe. And so which is why real friendships, real life friendships are important. And for that, joining what is better than joining a community group? But again, I understand that not everybody has access to these things, and so that also has to be kept in mind. Then another thing is engaging in hobbies. Like a lot of elderly might be knowing how to sing, how to dance, how to paint, write. They could be writers, poets. They could be knowing how to do craft work like stitching, knitting, etc. So stitching, knitting might be a little difficult, but knitting, bigger things like where eyesight is even a little low eyesight is also okay. Such kind of things, maybe drawing a rangoli, or then these things can be done. So there was I think there were conducting even singing competitions for elderly, like Seniors Got Talent on, I think on YouTube it was there. I had, when I was searching for kind of activities, those can be a good option for them to engage themselves in activities that probably they had left when they were working, when they were busy with their routine. So So that can be done. That can be one thing. And they can visit library. If they know they are educated, they can illiterate, and they have an interest in books. They can visit library. They can engage themselves in reading books. They can actually they can also start writing, maybe blogging, online blogging. They can share because elderly have a lot of knowledge, a lot of experiences to share with the younger generation that would be of great help to us. So they can also try doing that if they have access to internet and access to blogging sites, and if they're with the little help of their children. Like when I was browsing about this topic, I found that there are few people who actually in the age group of more than 60 years, they have Instagram and YouTube channels where they share recipes, and they share different tips from small things from day-to-day lives. So such kind of things can be encouraged. Those are desirable, so that they are engaged in some activity and they do not feel very lonely. And daycare centers where elderly meet people of their age group, make friendships, stay there, stay occupied, and stay active. That is one thing. And institutions and old age homes, where that I kept it at last on purpose, because that generally is the last resort when there is nobody there to take care of them, and they are sick and they are not able to manage themselves. Then institutions or old age homes can be a good option. And so there's something that had come up recently, I think called as Goodfellows. Organized Goodfellows is a startup by one of the young employees of, I think, Tata Industries. So this was it started with an intention to forge friendships among people of different generations, mainly elderly with the youngsters, so that the youngsters talk to them. They are like a young friend to the elderly, helping them out, and trying to engage them in different activities, or just being there for them so that they do not feel lonely. But then again, these kind of initiatives have their pros and cons. You cannot, so people have, you cannot trust somebody, right? So there are risks involved with this also. Pros are that you find somebody, so people with, you have a grandkid, like a person who is actually interacting with you and trying to reduce your distress. And that is one of the advantages that I personally feel. I don't know, I would like to get opinion from the esteemed audience who are attending the program today. And there are some risks involved, like again, wherever financial issues come up, and wherever some other issues also might come up, like risk safety is always an issue. So this is one thing. And there are some organizations like HelpAge India, which are trying to collect donations and help out old age people who are not very well off, who are not able to take care of themselves for their medicines, etc. And there's Nightingale's Medical Trust, which runs a lot of daycare services, old age homes across the country. And there's something called Dignity Foundation, where retired people go mingle with other people and interact and have a great time. So this is one thing. So these are some of the organizations that I had come across. And so then coming to caregivers also. So more often than not, we find that if there is an elderly person, the primary caregiver is their spouse, especially in our Indian society. So there is a lot of distress and burnout, especially when when the person they are taking care of has illnesses such as dementia, where they are completely dependent on their daily activities, on the basic needs, on the caregiver. The caregiver might feel distressed and burnt out. So when the person finally dies, this caregiver will be the survivor, and he or she might be feeling very lonely, and they do not know what to do. So all through the illness of the spouse or the elder person, like parent, if there is a senior citizen whose parent is alive and who was sick and the senior citizen was caring for them, all of a sudden they feel very empty, that they suddenly do not have anything to do. And that also might lead to this sense of loneliness and social isolation. They might also develop grief, bereavement. That bereavement might progress into pathological grief, where they completely start isolating themselves from others, and they start always thinking about the loss and preoccupied with the loss, leading to depression, where again they start feeling worthless. They feel there might be some guilt that I have not taken care of the person properly, which is why they have died. So that kind of a thing can occur. So caregivers, to mainly to prevent this, they should also engage themselves in other activities apart from caregiving. So take care of the person who needs care, but also take care of yourself. Pay some attention to your health, your mental health. And if there is any distress, please approach a qualified professional who can be a psychologist, he can be a psychiatrist, or even your family physician. But if you feel that distress, you feel burnt out, you feel that, I have done enough, or I'm not doing enough, or what am I doing? And or after death, if you feel that, I have not done anything, and that is increasingly interfering with your day-to-day activities, please consult a professional who is trained. Okay. Also, you can enroll yourself in support groups. There are a lot of support groups online, for example, for widows, there are widow support groups. I think even in Bangalore, there are a few. And there are support groups for people who are carers of cancer patients, who are, so you can also meet them. Then it is also okay to feel overwhelmed. You don't have to feel guilty about this, and you can seek help. You can always seek help, and it is okay to seek help for distress that you might experience. So coming to this, because the theme of the World Mental Health Week is that mental health is a universal human right. I will not talk much about this, but you all have a right as esteemed citizens of the country, of the world at large, to seek help for any kind of distress that you might be experiencing. Any kind of mental health issue that you might be experiencing. It might be anxiety, it might be depression, it might be sleep disturbances, it could be anything. You all have a right, and nobody can deny providing care to you. So that is something that you have to be aware of. You have a right to seek psychiatric help. You have right to seek any kind of mental health help from a psychologist or a psychiatrist or any mental health practitioner, and that you can always go and consult them at any time, so that the distress is not increasing and it is not causing any serious consequence. I would stop it here. I hope I was helpful. Any questions, please? I will check the chat box as well.
Doctor, there are some questions in the chat box.
Yes, sir. I am. Yes,
just
sir.
go through that. I mean, first one, doctor has asked the question. What he says is, in my practice, the world, Dr. Anand, can you just, can you just ask the question, doctor?
Yes, sir. Thank you, sir. Thank you so much.
Please go.
Congratulations,
Yes,
Anupama. That's wonderful insight. What I want to know is, what is the common age group which you come across the older people where loneliness is seen?
So mostly above, up to 70 years also, people are kind of managing the socializing. Above 70 is where you kind of see people feeling very lonely, and they express it also. Maybe above 80, I think it goes even higher up, because their age group people are all passing away, and they start feeling a lot distressed about that, and they also might be fearing death, or so that
This
is
is
very
what exactly I see in my geriatric practices. Above 80, they avoid going out of the house for various reasons, health reasons, no caregivers to take them outside. And only for follow-up also they come once in 3 months. So that is what we do in 80s. Anybody above 80, we write for medicines for 3 months. We don't expect them to come regularly. So these are the people which we are seeing that they are coming and almost they are telling, let me die. That's the first sentence that they bring to us. What is the use of me living? Okay, so that is how we are facing. And my second question is, what we see loneliness in the older people is purely an individualized. He may be living with many people in the home. There are many people in the home, but still he feels lonely. And I have patients who are alone in the home, widower, but
Sir? Sir?
What is happening, sir?
We have older persons who are lonely despite living with a family. Okay, they have all children, grandchildren, spouse in the home, and they still feel lonely. And there are people who are staying alone, widower, but they are very socially active. So, what's the take for your take for on this issue?
So, so the thing is, if they see, the thing is that family needs to be educated. At the same time, I feel we should understand, we should talk to them, as I think if they are brought to us, we should talk to them alone and understand what exactly is going on, like what exactly is going on in their mind, and probably give them some time to ventilate. And then maybe also talk to the family members. If we are able to find out any reason, we can talk to the family members and then provide an amicable solution where they can probably engage them in activities if they are interested at home itself. That can be one thing. That can be one thing that can be done.
In community screening or in hospital OPD screening, which scale do you recommend to identify loneliness in elderly?
There is this UCLA loneliness scale. That
is very number. It's 15. You want to recommend three item scale?
3-item scale would be easier to attempt because we can do it quickly.
Yeah. What is the value, specificity, and sensitivity of that scale? Or do you use regularly in your setup?
So we actually in the OPD we do not use. I would admit it, but we can use it actually. Try
No,
using
because
it.
this year I have started one small project on identification of loneliness in elderly. I have made this 3-item UCLA scale. Okay, so in Kannada I translated and they have to just put the question. So we do it in OPD because it's a 3-item, but sensitivity and specificity of this. And do you practice in NIMHANS?
So right now in the OPDs we do not generally we are not doing it. But it will be a good idea to apply the scale because we will have an objective assessment of the situation.
Okay. Thank you.
So,
Thank you so much.
I'm sorry for interfering. See, can you be a little more, elaborate on this, doctor? Because we, non-medical personnel, we also need to understand something about what Dr. Anand was telling. He was talking about some tests, isn't it?
Yes, sir. Yes, sir.
Yeah.
It is a scale. Basically, it is a rating scale. Okay. So it's a rating scale with questions which mention that whether they are able to maintain, whether they're able to relate with other people, whether they are able to maintain social connections, and whether they consider that they are lonely. This is a 3-item scale with questions which are like you ask them that do you feel that you do not have companionship? Do you feel left out or isolated? And you ask how often do you feel from others? So these 3 questions.
You are muted, doctor.
Hello.
You are now,
You need to unmute. You need to unmute people.
So, doctor, you need to unmute.
I have unmuted.
No, you are now visible. I mean, you are now visible and you are now hearing. And we are hearing that.
I think I was muted.
Yeah. See, I mean, there is a lot of rain going on. You see. There could be internet problems today. Lots of rains are there. I don't know how about in NIMHANS, but in our area, there's a lot of rain.
Okay. So, yeah. So what I was telling is we look at relatedness, social relatedness, and we look at their self-perceived feeling of loneliness, as well as how often do they feel left out when they are in a group. So these things, these three items can help. Also, apart from these, I think we can also look at this is a scale. This is a scale which can be applied on individuals come to a clinical setting or in a population, in a community, like when you screen for loneliness. So apart from this, I'm actually not aware of other scales. I have read about these two scales, UCLA scale, which is there's one big scale and there is one 3-item scale. So any other questions?
Yeah. There was another question from the chat box.
Yes. 1 second. Hi, yes, sir.
What is the common age group in whom loneliness is seen? What is the common?
Like I said, it's above 70. I think because 60 to 70 also people are still socializing. I do not have the stats actually today, but yes, more than 60, 70, they're still managing somehow. Above 70, they start feeling lonely. But like sir said, above 80, they may not be willing to come and even meet the doctor. They might not even be willing to socialize, though they might be internally feeling lonely because they are mostly depressed and they want to they are telling that that I want to die, what should I do by living, etc. So in such cases they might not explicitly express loneliness, but it is our duty or the family members or the caregivers duty to notice and seek help.
Tangaraji wants to ask some questions.
Yes sir.
Are you hearing, sir?
Yes,
are
sir.
you hearing, sir? Good evening.
Good evening, sir. We are hearing.
Good evening, sir. Good evening, sir.
Good evening, doctor. Loneliness, because people are residing in foreign countries, leaving their parents. One issue. It is unavoidable. And another thing, single persons are living without any help in rural areas. The old age homes are only meant for affordable persons and not for poor people. We are persistently sending a request to the government, state government and central government to organize old age home at district level headquarters, at least to maintain the destitute persons above 65, 70 like that. These things are not happening because NGOs are manpowering not to function free home old age homes. This is we are meeting district collectors frequently to identify land, get funds from central government and state government. It should be run by social welfare department. We are representing many times, but things are not happening. The reason we could not find out. Even MLAs, MPs, we are also representing. The affordable people, pensioners are managing with payment senior citizen homes. These things, loneliness are available in even in cities, even in rural areas. They are not taken care of. They are not able to get caregivers or caretakers. These things, our discussions are very going about loneliness. The reason how to manage the single persons, either a widower or without legal hair, like that. This is my question.
So, sir, thanks for the question. Actually, I think there has to be a lot of support from the governments as such, because in India, the focus is more on, I think, the young population and older population are invariably neglected, and it is assumed that everybody. So, this issue of people who are people living alone, people being destitute, is somehow not being taken up. Maybe maybe it could be infrastructure issues, maybe it could be logistic reasons. But I think we should all work towards writing representations and probably getting support for the elderly people of the country, because as the time passes, I think elderly population is going to only increase. And I think in such a thing, I think maybe governments should step in and maybe take over the matter into their hands. Like they do run state. I think even state-run old age homes are there, but again, I think there is a lot of the population that we have. I think even they are very less.
But we are having one association more than 200 persons. We are meeting, we are giving a support to them. But the poor, I am talking about the below poverty line people who are not able to get in touch with the doctors
Yes.
in district level or taluk level. Highest NIMHANS. NIMHANS is the highest person, an institution to look after the senior citizens who are in distress.
Yes. So maybe at outreach level, maybe we should conduct a screening and maybe look for opportunities where we can screen a large number of people, talk to them, understand their concerns and issues. Maybe that could be one of the good ideas where at the community level we can focus, because below poverty line we should go to them. We should try to find out what problems are there, and I think it's a responsibility of us as medical professionals, as well as I think maybe we should take help of the
Affordable
social.
persons, medical as well as affordable persons.
Yes, affordable people also who can contribute financially and help them out. So that's a good idea.
Some NGOs also, non-governmental organizations, they can also contribute in this field. But
Yes.
anyway, doctor, see, one thing I was just wondering, see, is it not possible for the person to avoid this loneliness? I mean, given such a situation of the spouse not there, etc., by following certain practices. See, like, being taking, going for walking, daily walkouts. And can you just suggest anything like that, doctor?
So like I said, sir, they can join. So I think these days we have a lot of these places where they conduct yoga classes or things like that. And people meet in parks, as simple as public parks. People go for a walk in the morning. So they can meet people, they can socialize, try to maintain some kind of social contact with others apart from family members. Though I think primarily family will be taking care of them, but also there is one thing that family also sometimes they may feel afraid that like you were also telling me yesterday that they may not send you out.
Yeah, that's the biggest problem.
That is one thing. So we should understand, probably negotiate with the family members as well and try to send them and try to get things done.
Create more and more awareness among with all the people. That is the only thing. I think probably awareness level should go up. See, today people are aware about this corona, but that kind of awareness should be there about this also, because this is equally a big problem facing the country. Thank you, doctor. I think Mala I mean, next.
May I, doctor?
I want to say something.
Yeah.
Sir,
Hello?
yes, sir, sir, Sathik sir, just next over, sir. Yeah, please start your video, ma. Mala,
Yeah.
Yes,
Hello.
I'm there.
your
I'm
video,
Yeah.
video is not there, ma.
Mr. Jambunathan, can I
Yes, sir.
talk?
I'll give you a chance, sir, next chance, sir.
Okay.
I,
I'll wait for you.
Yeah, please.
I want to stop. Doctor, you mentioned about mental health as a universal right.
Yes, yes.
Okay. So what are the privileges we get by making it as a right? Universal health as a mental health as a universal right means what are the special privileges we get?
Special privileges, as in you can always approach a mental health professional. Nobody can deny you, saying, you do not have anything. Nobody can deny you. First thing. Second thing that, so I think WHO is trying to make provisions where I think spread more awareness about mental health issues, and also to to make it more accessible at district level, at village level, at maybe at different levels, so that you don't have to travel far to get help. So even our mental health act also.
So it gets prioritized,
Yes,
like
yes.
physical health. Okay.
Yes.
And one more thing, doctor, is loneliness a state of mind?
So one thing, we cannot generalize it as a state of mind. Some people might genuinely be lonely because they do not have anybody to take care of them. They do not have any family. They're probably living alone. No spouse. They're not married. So that could also be one thing. So initially they may not feel lonely. They might be going about their work and all, but at a certain stage in life, that again, like that state of mind, like you said, it can occur. So the sense of being lonely. Loneliness is basically the sense of being lonely, right?
Yeah.
So, yes, it is a state of mind, but not all time.
Yeah, maybe they don't know the ways how to cope with.
Yes,
Maybe.
yes.
That's also there. And doctor, one more thing. You mentioned about some NGOs who give this daycare services
Yes,
to
yes.
lonely people. Can you please repeat? So I'm just noting down some Dignity Foundation.
Yes, sir. Dignity Foundation is there, ma'am. This, I think they have branches across the country.
Nightingale Medical Trust is there.
Yes, Nightingale Medical Trust is also there. Yes. So these
They
things
are
are the
based in
Dignity
Bangalore. They are based in Bangalore.
Based in Bangalore.
Okay, these two you mentioned about.
Yeah, Nightingale's Trust is there in Hyderabad also, I think.
Yeah, just they have opened there.
There in Delhi also, I think. And even Dignity Foundation is there across the country. You can.
In Kolar also, they are Nightingale Medical Trust is in Kolar. They have the dementia care center.
Thank you, doctor. Thank you.
And there is this destitute women, there is a place in Bangalore itself established by NMT and
Men and women both. Men is in
Sandhya Kirana and Sandhya Suraksha.
yeah, Sandhya Kirana, Sandhya Suraksha.
Sandhya Suraksha is for women and Sandhya Kirana is for men.
So, Sathik sir, you can go ahead, sir.
yeah, it is only a suggestion. You see, considering the question establishment of old age homes involves a lot of money and all that. See, as per the CSR, that is corporate social responsibility, though the document mentions various things, but in general, the scenario is it is mostly supporting the education and other activities leading to better facilities. So to bring awareness, in fact, I'm using the awareness word to these corporations. The Ministry of Social Defense should take initiative and bring them the to their knowledge the existing situation and see that they contribute something for old age homes also, and see they are brought into some acceptable standards. Probably they can think of various grades A, B, C, and all that depending on the facilities and that. This is just I thought I will just put forth to the audience here and
Audience, as well as when doctor visits some seminars or webinars or something like that with government, she can just sell this idea. So that, I mean, this is one good idea. Actually, this CSR, from CSR funds, nothing is coming for the old age people.
Yes.
Actually, yeah, old age people are never favorites for anybody. Let us be very clear on that. Even for the relatives or for the, I mean, for any community. For that, I tell you, see, there are, see, so one example I tell you is that, see, geriatric department is one department which takes care of the old people. How many hospitals have got geriatric department? On the other hand, tell me one hospital which does not have a, a department, neurosciences department. Every hospital has got, but geriatrics they normally avoid. So I think this is some geriatric population also needs to be attended to. That is one. I think we are thanks to Sathir sir. I think this suggestion is worth considering. Please put it up when you are getting a chance. Thank you, Doctor.
Definitely, sir. Thank you so much.
Thank you, Dr. Anupama.
Any other person, any other question? Dr. Anand is again raising hand.
I just listening to all honorable members' views. The old age home is not just a solution for all these things, because I do visit old age homes, and there the same story begins again. Why you are here? What made you come here? What are the domestic issues? What are the ageistic attitude? And even two older people are never good friends in old age home, I'll tell you. These are the practical issues which we should know. Sitting in room, we can tell, make 100 old age home. Okay, fine. But the people coming and staying in old age home, they are also not, they are also suffering from loneliness. It is not that they are not suffering from, see what happens, most of the things, mechanically things are happening. Morning you go for walk, okay. There is again a difference of opinion between two older people, and they quarrel, they have issues, they don't want to discuss about their family issues with them, and they don't eat together, though it is old age home. Their reason for everybody to come there is the same, either domestic abuse or being widower, whatever social reasons are there. But again, the older people have that attitude that I don't want to mix up with him, I don't want to mix up with him. They mix. So loneliness is an individualized issue, but I have experienced in my practice, and self-motivation is the answer for that. They have to be self-motivated even at the age of 80. Yes, I want to go and meet Mr. Tigeraju sir. I want to go and meet Dr. Anupama. That is how the motivation keeps them away from loneliness. That's what I have felt. And those who say, no, sir, I'm very old, I can't move around, I'm just sitting in the home doing nothing, they will end up with depression and all those DDs that happen, and they become mentally disabled. This is so, no matter how many old age homes we create, we have 4 geriatric medicine departments in our Karnataka state medical. My medical college has a MD geriatric medicine course. We are working in geriatric field from 2007. So what is important here is first identify and then ask, do you need help? Most of the older people, they say, no, I'll manage myself. Mind your business. This is how the people talk to us. So it is, we cannot make an umbrella like picture as Anupama was rightly telling. It has to be individualized. And some people, they feel better being lonely. This is what I was expecting Anupama to come with, because we may come across the people, they are happy staying alone or lonely. Okay, and only few will say that, no, I am feeling lonely and I want to come out of it. So unless we understand from their perspectives, unless we don't put our foot in their shoes, we will not be able to solve this issue. And because this is a multi-diversity community, no two older people are same. Even if you put the same table for a chai, for a tea time, they don't talk. That's what I see in most of the senior citizen meetings. Okay, so it is more of an individualized. Yes, loneliness is definitely an biggest medical social issue. We will be losing more older people for this disease. We have to do something, but all these are individualized, and we cannot make an umbrella picture for loneliness towards the entire Karnataka or entire India. That are my personal views.
Yes,
I would like to add what.
Just 1 minute, sir. Just 1 minute.
Hello.
We have now added a new facet or new, new method to this, new idea to this old age homes, etc. Doctor, that's very understandable. I agree. that there is no one size that fits all.
Yes.
Each
And I would
person,
like to add, see, everyone is a unique person. Let
everyone
us
is
not
a
forget
unique
it.
person.
Doctor knows better than
Yeah,
me.
yeah. Everyone is a unique person, but
Unique person.
by and large, what happens, doctor, we are trying to address a community issue. So in that community issue, we are trying to find out whether this could be a good solution. That is all. I 100% agree with you, doctor. Thanks for putting in this, new ideas and the new processes. It's good. I agree. But I have also visited many old age homes, doctor. There are old age homes where people are able to sync with others. There are. Of course, there are places, there also, actually, it is not universal. I mean, some people are able to sing, some people are not able to sing. Again, it is an individual issue, doctor. Probably, I think, a better grounding, grooming at this right from the age of, say, 40, 50 years might, to some extent, reduce this problem, doctor. Thank you. Thank you. You have brought in a very new point, doctor. Thank you.
I would like to add, see,
Please, sir. Please. Please, sir.
Jamunathan,
Yes, sir.
I would like to add a few words what Dr.
Please, sir. Please unmute yourself, sir. Sir, you are muted. Sir, you are muted.
So
Yeah.
people,
Please unmute, sir.
you can't generalize and put them one, as he rightly said, in one umbrella. Nobody will put it, because as doctor, he himself, he knows better than a non-doctor like me. But at every stage, after as we grow, we come across various things, and so the individual requirement itself changes. So you can't expect that there are 100 people, 100 requirements. In general, what are acceptable to the majority of the particular group? Again, we have to divide, etc., etc. So many things are, I don't want to elaborate and all that. Based on that, and we have to take the support of Ministry of Social Defense, and then see that this is conveyed to the corporate under corporate social responsibility, and see that at least, if not in 1 year or 2 years, the future senior citizens will benefit.
Exactly.
It's a very long-term process, because a lot of money is involved, and gradually people also will change, because that's there. So it's a very elaborate subject by itself. So I want to just conclude it. Thank you for the opportunity given to me to speak to.
Thank you, sir. Thank you, sir. I think all people are able to bring in new ideas, new different facets of the same problem. The problem has got several angles. This is a new angle that has been brought in. Thanks, sir. Thanks, sir.
Once again, thank you, Dr. Anupama, for giving this information. Nice session.
Pleasure is all mine, sir. It was nice interacting with everybody here.
You cannot start your video because the host has stopped it.
Any other person, any other questions, sir? Ladies and gentlemen, any other question, any other information you may like to seek from Dr. Anupama?
Sir, I think we can conclude.
Okay, 1 second. Before concluding, I just wanted to tell something. With Dr. Anupama, I should really thank you for an exhilarating session on this. The loneliness. We have never felt lonely today. You have taken us together. That is one thing. And with regard to the visit, viewers, I forgot to mention, Dr. Anupama is also a well-trained Carnatic singer. So I think she can talk about singing and how singing can help a person to become unlonely. Help a person to free from oneself from this loneliness. So with that, and one more thing I wanted to add is that please tell your friends, these are all webinars being organized by this NIMHANS, from the geriatric departments of NIMHANS, at a huge cost. There are so many hospitals, but no other hospital runs these kinds of programs. And one important factor of these programs is that we don't promote any product, we don't endorse any brand. We just try to give you pure knowledge. That too, not from WhatsApp University, but from highly qualified doctors whom you will be whom we will not be able to meet at all in a consultation situation, because they are so busy that they cannot spend more than 5 minutes with you. See, that kind of doctors we are able to get, and I should really thank them for the time that they are spending, for the knowledge they are sharing. Therefore, please tell your friends also, so that these webinars, which are conducted only once in a month on second Monday between 4 and 5 p.m., please ask them to attend, so that they can gain knowledge for themselves. And nothing is equal to self-knowledge. And self-knowledge, real power is self-knowledge when it is used.
Thank you, Mr. Jambanathan. Thank you. 1 hour we have listened almost all subjects by doctor. Both doctors have expressed their views. Thank you very much, Nisha. Thank you very much. All the best.
Yeah, so can I conclude?
Please, please go ahead.
Yes. 5 o'clock.
Yeah. So as a part of Monday webinar series, we have organized this on loneliness. So tomorrow is World Mental Health Day. I have to mention that also. So my duty is to say a lot of thanks to everyone. First of all, I would like to thank Dr. Anupama V V, because in the we all know how busy she will be in OPD. She has spent a lot of time to prepare this program, and she interacted very well with you all. And I hope it was very informative for you all. Actually, her parents are also here, I guess. So thank you for participating.
You are muted, Bak.
Oh, okay.
Yeah.
It's just got muted or?
Yeah, it got muted.
Okay.
Yeah,
So my duty is to say word of thanks to Dr. Anupama. She has spent a lot of time with us, and she prepared a lot to present this session. Her parents was also here, I guess.
No, in fact, if you tell their parents' name, I will just pin them, so that we'll thank them also for bringing out such a nice child.
Ramana and Lakshmi.
What is that?
Ramana and Lakshmi.
Ramana, there is one Lakshmi is there. Lakshmi.
Not that Lakshmi, I guess. V V Ramana.
V V Ramana. V V Lakshmi is there.
Yeah. V V Ramana, V V Lakshmi, I guess.
I have asked them to start video. I'm also.
It's okay, fine. She is also busy.
Yeah. Oh, but they need to be proud about them, and we need to thank them also, ma.
Yeah.
Yes, thank you, ma. Thank you. Yeah, it's their wish. I have requested them to unmute and start the video. It is for them to do that. Yeah.
It was nice meeting this.
Ramana is visible. Yeah, Lakshmi Madam is also visible.
Man is also
visible. Lakshmi is visible. So be a proud parent, ma. Thank you. We are proud of your daughter.
Thank you, sir.
So I would like to thank them also for participating for this 1 hour. So I would like to express my sincere gratitude to IPS Karnataka chapter, IMS Samadhana Center, and all those participants who have spent valuable time with us. Thank you all.
Thank you.